There are now more than 118,000 cases in 114 countries, and 4,291 people have lost their lives.
The virus was traced back to this now-closed seafood and meat market.
Hospitals.
In 2020, the world country, including Malaysia, has faced a dangerous epidemic known as COVID-19, and they are very dangerous to other people. And there was no cure. COVID-19, or its scientific is coronavirus, a large family virus that cause illness ranging from the common cold to more severe disease. A novel coronavirus is a new strain that has not been previously identified in humans. COVID-19, this occurs in Wuhan, is due by happen from market by the sellers that sell the wild animal like bat and snake. The COVID-19 had identified in Wuhan, China for the first case lately in 2019. In March 2020, the World Health Organization declared the virus spread rapidly around the globe. The first case in Malaysia was confirmed among Chinese visitors in Johor via Singapore. The most notable was the Tablighi congregation gathering in Seri Petaling, Kuala Lumpur, which triggered a hard surge of local cases, and in March, the number of cases had increased from under 30 to over 2,000. COVID-19 patients have reported a wide range of symptoms ranging from mild symptoms to severe disease like fever, cough, persistent pain or pressure in the chest. Symptoms might emerge anywhere from 2 to 14 days after being exposed to the virus. The party involved in managing this pandemic is the members of Minister of Health like Tan Sri Dato' Sri Dr. Nur Hisham bin Abdullah and Health Minister YB Tuan Khairi Jamaluddin Abu Bakar. It is also assisted by frontlines like Malaysian Armed Force, ATM, Royal Malaysian Police, PDRM, doctors and nurses. The outbreak of the COVID-19 pandemic since the end of last year has had a major impact on the economy around the world as well as in Malaysia. Economic recession due to the implementation of the lockdown that causing many economic sectors to be stopped. Most employees had to be laid off because the organisation could not afford to pay salaries. All of citizens and the authorities have the consequences of this problem. Furthermore, the health of the people is deteriorating so much so that many people are admitted to hospitals due to being infected with this disease. Next, many deaths occurred among the people, and the MOH reported a death rate and found almost over 60 deaths per day.
The sudden outbreak of COVID-19 in Malaysia is increasing by the day. The government is shocked and confused by the sudden situation. This unexpected occurrence poses a threat to the Malaysian government, especially the Ministry of Health. This has led the government to formulate a strategy to counter the COVID-19 outbreak. They need to present various solutions to ensure that they can achieve their goals while eradicating all the difficulties in line with their work. On March 18, 2020, a movement control order MCO was implemented by the Ministry of Health to keep the spread and mortality under control. The MCO focused on the restriction of people's mobility into and out of a specific area. The Ministry of Health Director General highlighted that the order was issued by the Prevention and Management of Infectious Disease Act 1988 and Police Act 1967 would aid in the control of the virus's spread. Other than that, to fight against the virus, the Malaysian government urged the community to comply with the standard operating procedure (SOP), such as wearing a mask when going outside, keep 1 meter distances from other people, and avoiding interaction as much as possible. The Ministry of Health also created a strategic plan to help against the COVID-19 in Malaysia. A resurgence of infections occurred in late September 2020 with a significant increase in the number of illness reaching over 4,000 cases per day by mid-January 2021. In order to achieve herd immunity, the government encouraged the community to be vaccinated. The COVID-19 vaccine have been approved by the Food and Drug Administration (FDA) to use for a mass immunization program from June 15, 2021. The clinical trial findings indicate that this vaccination can protect recipients from COVID-19 infection by generating antibodies and establishing immunity against the virus. Malaysian authorities obtained the COVID-19 vaccine through a government-to-government agreement with the Republic of China, direct purchases from pharmaceutical companies, and the COVID-19 Global Vaccine Access Facility. This vaccination plan is a long-term plan to increase people's immunity against COVID-19.
Organizing is the second key of management function after planning that coordinates human efforts, organize resources, and combine these two to assist in the achievement of goals. Says the Burnett in 1886 till 1961 was remarked, organizing is a function by which concern is able to define role position, related jobs, and the coordination between power and responsibility. An effective organization depends on the mastery of several important concepts such as job specialization, the chain of command, authority, delegation, span of control, centralization, and decentralization. The majority of these theories are based on Henry Fayol's principles to ensure that an organization can be distributed burden equitably to all members of the organization using the job specialization approach. Therefore, the organizations can perform effective work while avoiding duplication of effort and lowering the cost of employing both professional and non-professional workers. At the onset of the outbreak in COVID-19, WHO had established the Incident Management System (IMS) to give further assistance to Malaysia. Therefore, Malaysia has closed its borders and only allowed Malaysians to enter the country, followed by a 14-day mandatory quarantine period. This refers to the unity of command principle, which states that every well-established organization requires a supervisor who is directly responsible for dealing with the problem. This also approach that the strategy and actions that have been taken are centered on the WHO department through the centralization factor, which influence all work done and can be great results for the country. Apart from that, the COVID-19 test detection technique has been implemented among Malaysians, which is STITQ, Search, Test, Isolate, Treat, and Quarantine. The government of Malaysia has established 140 quarantine centers across the country with the help of the National Disaster Management Agency, NADMA, to regulate the facilities. According to the government, those who are asymptomatic will be hospitalized for at least 14 days if they test positive in COVID-19. The strategy aligned with the organizational elements span of control by ensuring that every plan of action that is undertaken by Malaysia is effective or at least resulting in a good reaction to the country. Subsequently, Malaysian government organizations have also done some specialization work in dealing with this issue. This involved the Royal Malaysian Police (PDRM) and the Malaysian Armed Force (ATM) in implementing roadblocks during the Movement Control Order (MCO) and Ministry of Health Malaysia (MOH) in formulating strategies and give recommendations to be taken in order to reduce the spread of COVID-19. Eventually, the concept of authority, which describes the authority of the employees who support the authorities of the department by providing advice and services to solve an organization's challenges, is introduced. The Malaysian government has delegated full responsibility to the Ministry of Health Malaysia by implementing the MOH recommendations through the vaccination process. The Minister of Health has also issued regulations on the prevention and control of communicable disease 2020 on 18 March 2020.
The decision-making that made by our Ministry of Health is still trying to reduce the number of patients who are in quarantine center as well as in ward. To reduce COVID-19 case, the government has planned to conduct a Movement Control Order (MCO). The decision made by the Ministry of Health to implement the Movement Control Order was the right decision, as it could reduce the rate of infection to the public, as the virus can be spread through contact. During the Movement Control Order, only one member of the household can go out to buy necessities, while those who have emergency and need to cross the state have to ask permission from the police. Due to Movement Control Order, Malaysia's success in lowering the case of COVID-19. Next, the Ministry of Health also tried to identify individuals with COVID-19 symptoms. In this way, we can protect the public from being infected with this virus. Given at the time COVID-19 case is increasing, to identify someone who has symptoms of COVID-19, Ministry of Health has decided to place thermal scanner at country entry points and also in any place such as grocery stores and malls. More also provide facilities and hospitals to treat those who are infected. Because of that, Ministry of Health opened the largest quarantine center and also identified 26 hospitals in Malaysia that will be used to treat COVID-19 patients. Apart from that, with the opening of Mike Serdang Quarantine Center, it can accommodate a large number of COVID-19 patients. The quarantine center also makes it easier for health workers to monitor those who are infected. Ministry of Health also tried to vaccine all the Malaysian citizens. In 2021, Malaysians once again have to undergo a Movement Control Order for the second time because we are experiencing a second wave for the COVID-19 case. What made the situation worse is the new and more dangerous COVID-19 variant. Due to this case, the government has decided to grant vaccine to all Malaysian citizens. with the vaccine, we managed to lower the COVID-19 case. Among the mistakes that has been made by the Ministry of Health is human error when giving the vaccine. There are those of us who have received an empty syringe. Controlling that has been made by the Ministry of Health to ensure the movement control order runs smoothly is that the public cannot do any of this gathering, including wedding and religious festival. This done to avoid the existence of new cluster. Next, the public is also not allowed to be outside of the house. Only one member can go out of the house and buy necessities, and also the government put a limit on the number of those who can enter the supermarket. Apart from that, we also cannot cross country or district. This to prevent any new variant from entering the country. Not only that, with the MCO, the government has little time to prepare health workers to fight this pandemic. The second control done to identify individuals with COVID-19 symptoms is that the government requires us to scan the temperature before entering any premise. If we do not scan the temperature, we cannot enter the premise. The temperature we scan should not be more than 36.7 degrees. Otherwise, the alarm will sound and we cannot enter the premise. The government also requires those who have close contact with the COVID-19 patient to perform a swab test. Although the result is negative, but they need to also quarantine and will be given a pink bracelet. They cannot leave the house for 14 days. If they do not comply with the rules, then the government can take legal action. If the result is positive, they need to update the result in MySejahtera application. The third control is to provide facilities and hospitals to treat those who are infected. The Ministry of Health also placed many health workers to monitor the condition of patients there. The government has also placed a total of 604 beds for patients. Not only that, but the hall also has an air conditioner and facilities such as Wi-Fi, television, and even a computer. This quarantine center is not only for the people of Selangor, but those who are from Perak and Melaka also brought there. With various facility and effective system, MAIX has managed to become the best quarantine center. The first control is vaccination for all Malaysians. The government has suggested healthcare staff who will receive the COVID-19 vaccine first because they are the frontliner. Next are those who are 16 years old and the public who will receive the vaccine. For those who want the vaccine, they need to register in MySejahtera application and have to wait for their turn. At first, the government had a problem with the vaccine supply, but we managed to overcome it and bring a large amount of vaccine. To ensure that all Malaysians receive the vaccine, the government has set rules where a person must complete the vaccination if they want to enter any business premise. In addition, to speed up the vaccination process, the government has opened many vaccination centers. The government has also recruited many civilian volunteers to help the process at the vaccination center.
What we found is the COVID-19 pandemic has had a very negative impact on the whole country. COVID-19 is already putting us to the test in ways that most of us have never faced before, delivering emotional and economic shocks that we are fighting to overcome. The violence that is now developing as a dark characteristic of this pandemic is a reflection and a change to our shared humanity, resilience, and values. All members of MOH have made various initiatives to reduce COVID cases in Malaysia. Among others, the head of MOH has made a movement control under to restrict all residents from crossing district or state. In addition, it has made SOP to counter the contagion of the virus, like wearing a face mask when in a busy location is one of them, as is using hand sanitizer, and each permit should include a temperature. Besides that, it has had a significant negative impact on the country as many individuals have lost money because of the tourism sector's inability to operate normally. As a result, the country income has also decreased. Therefore, as responsible citizens, we need to follow what is said by the authorities so that COVID cases can be controlled in Malaysia.